I'd like to start my talk with a question that's posed to a lot of our public school students, and you get this as an adult too, and it's the lifeboat problem. And the lifeboat problem is when your ship sinks, the Titanic or whatever, and you're in a lifeboat, and there are 12 of you in the lifeboat, and the lifeboat can only hold 10 people. And somebody realizes that and says this lifeboat's going to sink unless we throw 2 people overboard. And this is taught in public schools. What do we do? And the students are taught that someone has to take charge and decide which 2 people get thrown overboard because there isn't enough of a resource there. And really, that is the same mindset that's being forced upon us in healthcare. The idea that there's not enough healthcare available for everybody, that we have to start to ration. Somebody has to control. The federal government has to have controls put in. Insurance companies have to put controls in. Of course, from insurance companies' perspective, they are trying to make more money. So from their perspective, they do have a bit of a lifeboat problem. But what is the flaw? What's the flaw in the lifeboat problem? If your child or grandchild comes to you and says that they were presented with this problem and they had to throw 2 people overboard, and they picked someone who had a disability, or they picked someone who was older, and that's what the students are taught to do, by the way. Where's the mistake? I mean, what do you tell your child or grandchild that's wrong in the lifeboat thinking? Well, that's what they're trying to teach, and they're saying you throw the less valuable person over. There's innovation. There's innovation in healthcare. And in the lifeboat problem, you don't know what's going to happen next. Maybe a helicopter is going to show up. Maybe someone's going to figure out how you could fit 12 people on it. There's innovation that's not part of the problem. You can ask for volunteers. Maybe there are people who would volunteer when there's a scarce resource. Or there's even a more clever solution that I've developed. And that is you take charge of the boat and you say we're all going to sink. Unless somebody volunteers, we're all going to sink. We're all going to die. And then at that point, somebody does something wrong. And someone says, no, I'm not going to die. I'm going to take charge of this lifeboat, and I'm going to make these decisions of who lives and who dies. And you take that person, you throw him overboard. And that's what we're doing with the electoral process. That's what we're doing. The liberals are saying we're going to take charge of this. We're going to make decisions who gets care and who doesn't. And we're going to throw them overboard in the elections. And we've already started doing that. That's the solution. And then it opens it up to the free market, right? And the free market is wonderful in the way that it can come up with unexpected solutions. Okay, the Lasik Eye Surgery. When that first came on the market to correct nearsightedness, it cost $6,000. Insurance companies didn't pay for it. It was cash. It was the free market that developed that. And then comes competition. And now that price has dropped from $6,000 down to $100 in some markets for that Lasik eye surgery. That's not due to insurance companies. That's due to the cash market. And what we're here to suggest to everybody in attendance is to consider making your practice more of a cash market. Consider going all to cash if you can, depending on your specialty. And by cash, I mean cash and credit cards, basically insurance company free, where someone comes in, as I do when I go to a doctor, and I give them my credit card, and it's a modest charge of $100 for a physical or a checkup or whatever. There's no insurance company. There's no paperwork. There's no billing. The staff is much happier, much easier to deal with. They're happy when you come in the office. You're another customer. They're happy that you're going to pay them, that they don't have to fill out a lot of paperwork. When you get stuck in an insurance-based practice and there's all that paperwork, you have an unhappy staff. You have a staff that over time resents filling out all that paperwork. They start to get jealous of the doctor. They start to think they're not making enough. They start to file false allegations against the doctor. A lot of problems that doctors have actually come from their own staff in insurance-based practices where a staff that's unhappy or jealous or disgruntled or angry for some reason then files an allegation against the doctor. You don't see that in cash practices. Cash practices, staff are part of the team. They're there, it's more of a business. They're there to make the business succeed. They're not as angry. The patients are happier when you have a cash practice. It's fairer, it's more efficient. It's open to everyone. You don't have to turn people away if they don't have the right insurance and so on. So we have a number of doctors in AAPS who have gone to cash, and they say it's one of the best decisions they ever made. Malpractice, you have fewer malpractice claims when you have a cash practice. If a patient is unhappy with the treatment you provided or the service you provided, you have a remedy. You can give the patient a refund. You can't do that if it's insurance billing. You have no remedy for the patient. If the patient's disgruntled, the patient is more likely to sue you. You can't give the patient a refund. It wasn't the patient who paid. And of course, you get a different type of patient mentality. The patients who are in insurance or in Medicare, they're looking for an entitlement. That's the mindset. You get a lot of people who want more, who want what they can get and want more than what they paid for. You don't get that with the cash-paying patients. They understand they get what they pay for. So cash practices are highly advantageous to physicians, and I encourage more people to shift into it. There's a lot of cash out there. You know how much cash there is out there in the world, dollars? $539 trillion out there in cash, floating around in people's pockets, ready to spend. There's a lot there for you. And actually, the biggest part of that, you know what denomination is the biggest part of that $539 trillion? Which denomination? $1 bills, $5, $50, $100 bills. Yeah. And you know who holds a lot of that $539 trillion? Foreigners. Foreigners value the cash even more than we do. We take it for granted. Of course, we're stuck in the insurance system that we have now and all the entitlements. Foreigners, they value cash, and they're holding a lot of our dollars in currency, and they're holding in $100 bills. Cash is better for the poor. There's less paperwork. I've seen doctors who office visits, $50, $65. The poor can take advantage of that better. It's a fairer system. Immigrants, people who are here illegally, can pay cash. That's a question that never got resolved in Obamacare, is what about people who are not here legally? What about the medical care? Well, cash resolves that problem. People pay cash, they pay cash. Obamacare was never able to fully resolve that. So cash is something that is better. It's better for the market, it's better for innovation. It's something we should all consider going to. All right, let me talk a little bit about medical boards, because we've been doing a lot of work on that, and particularly here in Texas, the Texas Medical Board, but we've been doing it in other places too. And the problem of how anybody can file a complaint against any doctor at any time in most states, and the complaint is never given to the doctor. So the doctor doesn't even know who filed it. That varies from state to state. But in Texas and a lot of the big states, the complaint is not given to the doctor. So it can be a competitor. It can be your own employee. It can be someone in the hospital. It can be a nurse. It can be somebody who doesn't like you. It can be your neighbor. It can be a complete stranger. And we've seen that. A complete stranger has looked at a doctor's testimonials and filed a complaint against that doctor based on testimonials that the doctor publicized. Imagine that. The patients are completely happy with the care. The patient keeps coming back, but someone sent in a complaint to the medical board, and now the doctor has to spend $10,000, $20,000, $30,000, $50,000, $100,000. It gets very expensive, and the doctor has all the stress because the doctor's license can be revoked. The doctor's license can be taken away from him based on a complaint that was never provided to him. That seems fundamentally wrong. And so we put in a big effort last year here in Texas to pass a number of reforms to the way that complaints are handled here in Texas. And we got a good reception by the legislators. And the first reform was to turn over a copy of the complaint to the doctor so he can see who filed it. He can see what's really behind it. So he's not just fighting in the dark. And the dental board does that here in Texas. Other boards will do that, but the medical boards in Texas and in some other places don't do that. So we said, let's put that in the law, that they will turn that over.